According to Western society, breast is considered part of feminine beauty. Any threat to breast have an effect on women's self-image and sexuality. Breast disorders may be benign or cancerous. The objectives for this lesson include the review of benign breast conditions, be able to analyze treatment modalities for benign and cancerous breast conditions, and be able to review and design nursing care of clients with both benign and cancerous breast conditions. Here are two diagrams indicating the technique used for breast self-exam. Be able to demonstrate and discuss the breast self-exam with patients. Okay, we are going to discuss a few benign breast disorders. The first one we are going to discuss is fibroadenoma. It is a benign tumor during the reproductive years. It is a connective tissue that is unattached to the surrounding breast tissue and is usually discovered by the woman herself or during mammography. Ultrasound or needle aspiration is done to discover if it is a solid or cystic. It is a solid, it is removed under local anesthetic. Then we have gynecomastia, literally meaning female breast, and is a symptom rather than a disease. It is a benign condition of breast enlargement in men. It may be bilateral but may be asymmetric in a few cases. It is caused by an abnormal growth of the glandular tissue, including the mammary ducts and ductal tissue. Some risk factors may be due to drugs such as anti-androgen agents and corticosteroids, aging, obesity, underlying disease causing estrogen excess such as malnutrition, liver disease, or hyperthyroidism, and the patient may have an androgen deficiency state such as age, chronic kidney disease, or alcoholism. Another benign disorder is fibrocystic breast condition. It is a condition with rubbery, ill-defined lumps that can arise in the breast, commonly in the upper outer quadrant. Fibrocystic breast conditions include a range of changes involving the lobules, ducts, and stromal tissues of the breast. Imbalance in the normal estrogen to progesterone ratio most often occurs in premenopausal women ages 20 to 50. Symptoms may include breast pain in tender lumps or areas of thickening in the breast. The two main features of fibrocystic breast condition are fibrosis and cyst. Can be cyclic based upon menses. Some cases fine needle aspiration or removal is indicated. Most management is focused on the symptoms such as supportive measures as oral contraceptives to suppress oversecretion of estrogen, progestins, danazol, which is only in severe cases, and to suppress ovarian function. Then there's mild analgesics and supportive bra. We also need to encourage for the breast self-examination. Ductal ectasia, another benign disorder usually seen in women approaching menopause, occurs when breast duct dilates and walls thicken, causing the duct to become blocked. A mass develops that feels hard, has irregular borders, and may be tender. A greenish-brown nipple discharge, enlarged axillary nodes, and redness and edema over the site of the mass is noted. There will need to be a microscopic exam of the nipple discharge. Ductal ectasia may resolve without treatment. The last benign breast disorder we will discuss is the intraductal papilloma. It occurs most often in women between the ages of 40 to 55. It is a benign process in the epithelial lining of the duct and forms a papilloma. Clinical manifestations such as bloody or serous nipple discharge is noted. A microscopic exam of the discharge and surgical excision of the mass and duct are indicated. Okay, now we're going to discuss breast cancer. Cancer of the breast begins as a single transformed cell that grows and multiplies in the epithelial cells lining one or more of the mammary ducts or lobules. It is a heterogeneous disease, having many forms with different clinical presentations and different responses to therapy. It is the leading cancer of women in the United States and second to lung cancer for cause of death. 20% are non-invasive and 80% are invasive. The key is early detection. The 5-year survival rate for local breast cancer is 98%. And 5-year survival rate for cancer that has reached the regional lymph nodes is 81%. The most common sites of metastatic disease from breast cancer are bone, lungs, brain, and liver. Treatment is related to site affected and to the function that it is impaired. 2 non-invasive breast cancers are ductal carcinoma in situ, DCIS, and lobular carcinoma in situ, LCIS. DCIS is an early form and is located within the duct with no invasion of the surrounding fatty breast tissue. If left untreated, it may spread to the surrounding breast tissue over a period of years. There presently is a concern of DCIS leading to invasive breast cancer if it is left untreated. Research is still in progress regarding this concern. LCIS is rare and usually identified accidentally via biopsy performed for other concerns. LCIS increases risk for developing separate breast cancer at a later date. Surgical excision is primary treatment for LCIS. The 2 types of invasive breast cancers are infiltrating ductal carcinoma and inflammatory breast cancer. The most common type of invasive breast cancer is the infiltrating ductal carcinoma. The disease originates in the mammary ducts and grows in the epithelial cells lining these ducts. It grows in the tissues in an irregular pattern, resulting in an irregular, poorly defined mass. Fibrosis develops around the cancer, causing shortening of the Cooper's ligaments, resulting in dimpling of the skin. An edematous thickening and pitting of the breast cancer is referred to as peau d'orange or the orange peel skin appearance. It is a sign indicating advanced breast cancer. Inflammatory breast cancer, also known as IBC, is rare but a highly aggressive form of invasive breast cancer. Clinical manifestations include swelling, skin redness, and pain in the breast. It's difficult to detect via palpation and may not show up on a mammogram. Due to this undetection, IBC may not be diagnosed until it is in the later stages, which result in unsuccessful treatments. Okay, let's discuss breast cancer, men versus women. We'll talk about men first. Less than 1%. It's very rare. The age of onset is 60 years. It's a genetic mutation of the BRCA1 or 2. It affects the subareolar mass and it's hard, painless, nipple discharge, retraction, erosion, or ulceration. May possibly be gynecomastia, and they have the same type of treatment as women do. Now, women have a little more increased risk, 5% in women that is less than 40 years of age. It's a genetic predisposition. They have the mutation of the BRCA1 or BRCA2. They may have a mass or lump which is painless or painful, nipple discharge, retraction, erosion, or ulceration, hard or undetectable, and they basically have the same type of treatment as males do. This is the end for Part 1, Breast Health.